What is going on, busy bariatrics? Today we're answering one of the most common questions I hear. Am I a candidate for bariatric surgery? It's not just that you want the surgery, there's actually very specific guidelines doctors and insurance companies use to decide whether or not you are a candidate. Let's go through them clearly so you know where to stand and what to expect. First, the basics. Most people qualify if their BMI is 40 or higher. That number usually means someone is carrying more than 100 pounds over their recommended weight. You can also qualify with a BMI of 35 if you have health conditions connected to weight. These could include type 2 diabetes, sleep apnea, or high blood pressure. Conditions that put serious stress on your body and are also considered comorbidities. The point is, the surgery is meant for people whose health is at risk and who haven't been able to maintain weight loss through other means like diet and exercise. Next, you'll go through evaluations. A medical evaluation makes sure your body can safely handle the surgery. That can mean anything from blood work, sometimes heart tests, and other tests depending on your history. You'll also meet with a psychologist. This isn't to disqualify you, it's more to make sure that you understand the changes are ahead and that no one is making you do this surgery other than yourself. Surgery is going to change your stomach, but not your mind, so the evaluation should help prepare you for the reality that you need to eat differently, dealing with emotions, and building new habits. Something to understand, though, is most of these psychological evaluations do not actually go into full therapy or into the detail. It's just to make sure that you are psychologically sound to have bariatric surgery. If you're using insurance, you're also going to have a process that goes around with that. A lot of companies require 3 to 6 months of supervised weight loss visits. Some even require nutrition or support classes, and it can feel slow at times, but it's their way of making sure that you're committed. It's why you need to make sure that you're talking with your primary care physician, as well as your medical team and your bariatric surgery team, to make sure that all of that paperwork is filed properly and that it's put in the right place. If you are paying out of pocket, the path can be quicker, but you'll still need those medical and psychological clearances. The truth is, you don't stumble into bariatric surgery, you work your way there. You have to show your surgeon and your insurance that you're ready for this tool and ready to use it responsibly. Surgery can give you a second chance, but it's still going to require effort. The people who succeed are usually the ones who understand that this is just the beginning of the work, not the end of it. So if you're asking yourself, are you a candidate? The short answer is probably yes if you meet any of the criteria we talked about. But the better question is, are you ready to commit to the changes that follow? If you found this helpful, subscribe to the channel, check out the rest of this top 10 playlist, and let's keep getting busy.